So, welcome back to the recovery series. We'll be starting this section of our recovery series a little bit differently than we did our last series. So far, we've labeled every Friday at 6 o'clock part of our recovery series, but specifically, let me just read off the topics so I get them right. We'll be looking into today, chronic injuries, followed by next week, getting back into exercise. The week after that, we'll be doing outdoor exercise and fun. So that'll be alternatives to your typical workouts that are more outdoor-led activities where you can get more involved in groups and things like that. We want to have a topic like this because obviously, as hopefully when we design this, numbers were still going down and we expect to be coming out of the lockdown soon. But still, it's a great thing to do just to give you an idea of where you'd like to go as the lockdown heads out. After outdoor exercise and fun, we're going to do a little tidbit on exercising at home and what are some of the tips and tricks and some of the best ways to find both expensive to moderate to inexpensive ways to exercise and optimize at your house. And then finally, we're going to be talking about sleep. These 5 categories are going to be a great way for us to finish out the semester here, talking about different ways about how these things can help optimize your workout environment, optimize yourself, and also optimize your recovery in a sense. Today, we're specifically going to be talking about chronic injuries. This is one that I'm actually really, really excited that we're doing. One of the main reasons that I'm so excited for this is chronic injuries typically fall into 2 specific criteria. Basically, you have the one type of chronic injury where you have a significant injury that pain continues to come back over and over and over because of, say, you had a slip disc in your back, or say you had a tear in your meniscus that you never got fixed, and you have a chronic pain from something that you hurt significantly, were not able to permanently fix, and you have to kind of deal with that style of pain or that type of discomfort to a certain level until you do something more drastic to try to fix it. The second type of chronic injury is individuals who continue to re-injure the exact same way over and over and over. So a good example of this would be someone that sprains their ankle. They never really rehab it. Then they sprain their ankle again, say like a year later. Then they do it again 6 months later. Then they do it again every year after that. And they always tend to continue to re-injure their ankle, their ankle in some way, shape, or form. You'll see this often you'll see this often in quad injuries, hamstring injuries, things like this. You tend to have a re-injury in a certain muscle or body part, and you tend to always get that injury back year after year, and it pretty consistently is always in the same spot. We're going to talk about those 2 different types of chronic injuries today. What's kind of the best course of action for why these injuries happen, how you should theoretically go about fixing them, and why you're still dealing with this pain in the grand scheme of things. We're going to start off by just kind of going into, we want to exclude a very specific type of injury from this. And this is one that I think a lot of people are going to be automatically defensive about, but it's important that we make a very distinct line between chronic injuries and things that you've always hurt but have never been truly diagnosed. Too often, and this is something when I say too often, I would say 30% of the time when I deal with a chronic injury or something that someone's been dealing with for a very long time, the most frustrating thing about it is that about 30% of the time, the person's never gone to a doctor. They've never seen any type of specialized care, or they sought out specialized care once. It did not work over a 1 to 2 week period. They never then followed up to do anything else or get a second opinion from another doctor. The problem with that type of chronic injury is very, very often than not, you're going into it with no information and a very little basis to go on. If you're going off of one doctor's opinion, off of a visit where they saw you one time, we're going to talk about what's kind of the very obvious downfalls of this. And this has really nothing to do with a doctor's expertise or them getting the answer wrong. We just kind of need to understand how the diagnosis of an injury really works. Many injuries are going to present to themselves incredibly similar to other injuries. So often when you're talking about a herniated disc in the back, a back spasm, a pinched nerve, all of these things can have almost identical symptoms when you go and you actually see your doctor, especially when it's originally inflamed. So if you see this doctor one time and they give you, say, a typical, treatment for this would be some type of medication to help get rid of the inflammation and the pain that's coming from that area, and then followed up with normally some form of rehab and or corrective exercises to try to get you to function better and get pain away from that area. Now, that being said, if the pain went away for a few days when you first started taking your prescription, then you kind of overdid it and went back into your regular regimen too quickly, and then you re-injured this, and you get frustrated, you run out of the medication, you don't really go to your rehab, or say you go to your rehab for 2 weeks, it starts to feel better, and then you say, oh, I'm fine, and you walk away. If you re-injure this a month later, we're still really talking about the same injury. We're still talking about the same problem that you originally had, but because of your eagerness, you found a way to re-injure yourself. Now, the obvious thing to do here would be to go back to that doctor, do some type of follow-up sample, and then once we go back to that doctor and do some form of a follow-up appointment, we can get better direction on what's going on. Sometimes this problem can be because you overdid it or you did too much during this time frame. Other times it can be that maybe we were steering in one direction because it really seemed like this was a herniated disc. You were in so much pain. It was very obvious that it seemed like we were heading in that category. And 9 out of 10 times it would be absolutely there, except when we did the MRI, or when we did the MRI prescription, since you started to feel better, you never actually went out and followed up and did your MRI. And the doctor never got a chance to get a viewing of what your injury is. And then you may find out that it may not have been a herniated disc the entire time. It could have been possibly degeneration within the disc that was also causing the pain, that though it's very, very similar, there is subtle differences, and it's going to change your treatment protocol depending on how you're going to deal with this injury. The reason why we want to, again, eliminate this style of injury from what we're talking about is that you started to do the correct process for looking into what's wrong with your injury, but you never truly followed what the doctor's orders are. You never really gave the treatment process a chance. It's important that we talk about that, because too often do we start a treatment process, not give it a correct chance, or we go on, we Google something, we go off of WebMD, we say, oh, this is the 2 most likely injuries that we have, but we happen to be a unique individual that we didn't get one of these really, really common injuries. We got something that is disguised as a really, really common injury. And we're just telling ourselves from now to the end of time, oh, I just have a herniated disc, but WebMD says there's nothing I can really do about it. I just got to stay in shape. So you go out and you choose to stay in shape and you think you're doing the right thing. But really, the right thing would be, is we always emphasize, you want to get first a primary opinion. You need to follow everything, the instructions that they're telling you. If for any reason you have setbacks, you need to refer to that original physician or original person that's doing your treatment. And if they get stuck, they'll even encourage you to go out and get a second opinion or another opinion to see if they're thinking still in the same area. The body's an incredibly complex thing. And if we're going to just take guesses and we're not going to do any kind of thorough checking into what could be wrong with us, it's very hard to ever fix those problems. And the reason why we bring this up specifically is I'd say at least 30% of the time when I'm dealing with an injury that's a chronic injury, it's people that within 2 to 3 treatments, I'm getting significant results because they assumed it was one thing. They never really followed up or looked into a physician or did anything of that nature. And they just assumed they knew the answer. And since they assumed they knew the answer, they were living in pain for no reason. It's very frustrating to me, mainly because the person is dealing with injuries or dealing with issues that they've never had to deal with if they just did the proper kind of like 3 to 4 step process when we go to looking at chronic injury or reoccurring injury. That's kind of something that we need to kind of take out when we talk about chronic and reoccurring injuries and kind of put it on the side. Because until you've officially gone in, seen a doctor, found out what's wrong, known for a fact that you know what's wrong, it's very hard to have a true treatment protocol so that you can find a way to get out of this. We're going to go over kind of 3 different areas within the body and talk about some of the common ways on how this is a chronic injury and then how this is a reoccurring injury and the subtle difference between the two. One of my favorite places to kind of start is going to be the ankle because we see this a lot. One of the first things that you'll always see from a chronic injury is someone that has a severe ankle sprain. So something that would be in the category of a 2 or a 3, meaning they significantly tore a part of one of the ligaments in their ankle, or they tore one of those ligaments completely. Because they tore that, the structural stability of the ankle is compromised. Now, obviously, when you do this on a minor level, the structure can scar down and give you a little bit of healing to allow for you to still have a significant amount of support. Now, again, if it did not, if it was not able to scar down or if it was completely torn, you're going to have to go in. And I don't mean by going with surgery, that is always an option, but we're going to talk about from a treatment standpoint here. We're going to have to go into this situation understanding that we need to compensate for the lack of support or the lack of structure that you now have due to that injury. Now, notice how it's important that when we have that level of a sprain, it is always good to have second opinions or some type of diagnostic testing to show us exactly what's wrong, because it helps us know that, hey, this is our main problem and we're going to have to use these aspects in order to fix it. Now, that being said, it can be different than if you had something that's like a reoccurring injury. And we're going to talk about a reoccurring injury would be something where we had maybe a 1st-degree sprain, but we tend to sprain this ankle every single year, but we haven't done any kind of significant damage to this ankle. We've just continued to sprain it in a similar way. Now, the reason why these two things are different and yet very, very similar is that in one case, we have an ankle that is compromised. In the other case, we have one that is being chronically injured, but yet it's not compromised. So what is the secondary reason for why we're having this issue? What we always are going to see and what this always is going to turn into is it's always going to be normally a issue of strength. If we have a structure that's completely gone and we need to be able to reinforce that structure and compensate for it, we need to build up strength in the calf and in the foot. We do this so that our body is going to be able to try and make up the difference for the other aspects that we're missing. Now, if we have a reoccurring injury, we're also going to start with strength as well. But we also want to sit down and we want to try to get an understanding for why this injury is reoccurring. Because again, since we haven't done that much damage, we know that for some reason you continue to sprain your ankle. So you could have a proprioception issue, you could have a footwear issue, you could have a biomechanic issue as far as the way that you run and the way that you do things could be compromising specifically that ankle and why you're having different injuries. The reason why there's a subtle difference here is that when we have a reoccurring injury, we know that there's no structural problems that we're compensating for. So what we need to do is we need to find the reason why you keep injuring the same ankle. While when we have an actual structural issue within the ankle, we know there is something that we need to compensate for, and that's the underlying issue for why you're going to re-injure yourself later on. That is a significant difference when we look at the way that we're going to treat this and move forward. A good example of this would be people that tend to sprain their ankles over and over, and they possibly have torn or completely damaged the ligament. They have an easy time coming back from ankle injuries because there's a little bit less for them to damage, but Obviously, this can lead to more severe injuries that can be much, much more significant. While people that continue to reoccur the same injuries, but they never have anything significantly structural there, they tend to have possibly chronic swelling or pain that's going to be in that joint line that's going to be continuing to sideline them, that keeps building up on top of injury, 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 injury. It's important that we kind of take these subtle cues and figure out how we're going to deal with these things. Now, one of the best things about rehab, one of the amazing things about the body, is that there is a lot of different ways that you can do things to establish the same goal. When we look at something like an ankle, the things that we really want to concentrate on is we want to look at, one, our calf strength, our ankle stability, and our overall proprioception, or our balance within the ankle joint, and our awareness to where the ankle is in space. Now, it's important that we talk about these things. One, because the first thing is going to be our calf strength and our ankle stability. Meaning, as I start to go onto the side of my ankle, do I have the strength to tell my body I need to correct this? I feel my ankle starting to turn a little bit, or I feel that I'm on the side of my ankle, and I'm going to correct this using my actual strength and muscles. Now, if you're having an issue doing this, and obviously there's ways to work on this or kind of pseudo test it when you're in the office and having someone balancing on an uneven surface and things of that nature, and looking at the way that they balance and use their joint, it's going to tell you, yes, this person does or does not have the strength and awareness to correct something before and preventively stop themselves before getting a significant injury. If they don't, you start to work on some of the different aspects that can help them prevent those things. Now, when we talk about the actual ankle strength, we're not really talking about specifically ankle strength, but I like to characterize this as am I able to put weight on my ankle in, say, an odd way? So walking on the sides of your feet, walking with your toes up in the air, walking all the way up on your toes as high as you can. Can I walk in these different positions without causing any type of pain or discomfort within my ankle? Can I walk in a not optimal way and structurally be able to hold everything where it needs to without feeling pain or damage and things of that nature? These are all things that we kind of have to test and go through to decide what you really need in order to fix this issue. Sometimes we find that with the chronic reoccurring injury, so they tend to hurt it over and over and over. They sometimes have built up some type of swelling or tissue, or we like to use terms like scar tissue, even though, again, unless you really test it and check for what it is, it's not truly scar tissue. So sometimes we just kind of call it like crepitus as like a general term for some type of inflammation that's under the skin, like that you can kind of feel and touch. It's important that we understand that we need to break up whatever might be there, because the pain that you might be feeling may not really be damage to your ligament, but excess scar tissue that may have formed on top of your ligament after the original injury. And your body has become to be hypersensitive to the breaking of that scar tissue, so that every time that you break a little bit of it, or you tweak it, or you injure it, you feel, oh my God, this is the end of the world. But in reality, we need to get rid of that in order for you to ever feel truly strong again. These are things, again, that as you go for a first opinion or a second opinion, given the nature of your injury and given the way you describe it, they'll start to be able to put pieces together and say, ooh, it really seems to be falling into this category. It's very hard to be able to figure this out after just one visit, because again, we're talking about something that's happening over multiple injuries that you've had. And since you've never cared for it properly, the problem has become worse and worse and worse. And yet it's still very fixable and very preventable, so that you can have a very strong ankle in the future without having issues. We're going to go away from the ankle now and talk about a different area of the body, only because I feel like we've summed up the ankle really well, mainly because strengthening, stability, and proprioception of the ankle are pretty much the key ways to fix the vast majority of problems in the ankle and foot. And that's also why when you go to the doctor and they give you a plan to use, they tend to be so similar, and it tends to feel like everyone's saying the same thing to you, because what I just described, you would do after a fracture of a bone, you do it after a torn ligament, you do it after a pulled muscle, you do it after severe bruising on the foot or calf. You do it in about 1,000,001 different areas, because the ankle is a very complex joint that's moving around, and it's bearing weight almost at all times, as long as you're, actually ambulating throughout your life and having a proper or improper gait, no matter what you're using it. Also, because of the position, gravity is always bringing blood to this area to bring in an excess of swelling. So they want to make sure that you have proper stability, you have a proper range of motion, you have proper strength, and you have proper stability, as you're going to be using this joint literally every day, all day for the rest of your life. So a lot of categories, a lot of injuries pretty much have the same treatment plan, but the subtleties within this plan are going to differentiate about how they're going to fix each and every one of those injuries. Whether you need more swelling control, whether you need more stability control so that your joint is more solid, whether you need an increase in range of motion because you have a decrease due to scar tissue or things like that. All those subtleties will be things that they see during the rehab process. They're going to help them get you better. But it's important that you don't get frustrated, because every doctor you go to tells you the same thing, because really it is a very, very similar process for the vast majority of ankle injuries as far as a rehabilitation sense. So it's important that you have a very open conversation with your doctor and whoever is doing your rehab, so you can tell them, hey, I am getting frustrated because people keep saying the same things, but I'm not getting better. And there's always going to be a very constructive conversation when you say that, so that you can find a way to feel better. Now, when we move on to a place like the back, this is where it starts to get a little bit more fun. The reason why I love the back, and I've always had a good deal of success as we go to a place like the back, is that there's a lot of different nerves, a lot of different musculature, a lot of different soft tissues that we're dealing with when we talk about the back, especially the low back, that can not complicate, but can make a very hard diagnostic process as far as diagnosing for that injury when you're just looking at it for even 2 hours on one day. When you're seeing a back when it's first inflamed and everyone has low back pain and they feel like they can barely get up and they have significant pain in their low back, it always seems very similar, many of the injuries. And you're using a lot of different special tests to try to figure out what's wrong when we talk about our low back. Low back or chronic low back pain is one of the most common injuries in adults today. Now, one of the reasons is going to be the posture that we all use. Sitting in chairs, we're not having a correct curvature in our spine because we're always hunched over, and we're not sitting up nice and straight and tall. So this is going to cause our spines to kind of lose some of the natural curvature that it should have. And you're going to start to have pain possibly in your mid-back to low back regions. This is also amplified by the fact that because we're sitting in these chairs with armrests and everything, we don't always keep our core tight. You can't tell this right now, but I'm rubbing my belly. So we don't keep our core tight, and this keeps a nice active core to also keep a proper alignment within our low back as well. And this now, again, it doesn't have to be, oh my God, I'm squeezing my core as hard as I can. It just needs to be active. Now, by having this nice active core, it naturally brings me back up. I activate my shoulders, I activate my upper back, I bring everything back, I get into more of a correct position here, and I can sit like this for a very long time, but it's very easy to see why as we reach for the keyboard and the mouse and the things of that nature, we naturally start to lean over and we naturally start to slouch. It's important that we understand that when we're doing these things, these are everyday occurrences that cause these injuries to happen. A really good example for reoccurring and chronic injuries of the back, again, we're going to say a herniated disc is a great example of that for something that's a chronic injury. We're getting really, really far in science, but right now that's still not something that we're great at. We can't give you a new disc. There's no way to give you a new disc in your back yet, at least not 100% successfully, but they are working on it every day and getting closer and closer. So you need to understand that once you start to break down these discs in your back, It's all about all the things you can do to maintain a proper core and a proper alignment so that we can keep as much pressure off of the nerves and off of the other tissues that surround the spine that's causing you pain. Now, again, it's really important that we do go in there and we do get an MRI or some type of diagnostic testing to tell us the degree, because again, not all these things are created equal. A good example of this is for some individuals, you may have to get some type of a shot or prescription, or even sometimes they might have to go in and work on possibly a surgery in the low back, because the way that the disc has come out and how it directly impacts that nerve can greatly change what your outcomes can be as far as rehab. Now, that being said, it doesn't mean we're not going to try a rehab. It just means that if you're doing 8 weeks, 12 weeks of rehab with little to no improvement, that's giving us a really big red flag that you're either doing something wrong, or this could be a very specific type of herniation that's not going to be directly fixed by rehabilitation there. Now, again, most of the individuals that we're talking about with chronic injuries, they're really not doing that 12 weeks of therapy like we're hoping for. They're maybe doing 2, feeling better and leaving, or they're never going to the doctor at all and saying, like my back flares up sometimes. This is why we emphasize in the beginning, it's really important that we go through the proper process, because they're very successful at taking away pain, especially in these areas nowadays, if you go about the right means to try to sort that out. A good example is something that I'm seeing more commonly now. It's not an end all be all, and it's definitely not a first thing that we would go to. But many pain management doctors, I've seen internal medicine doctors do this as well. And I'm assuming also orthopedic surgeons would do it as well, is they'll do a like an ultrasound guided or an instrument guided injection, where they'll literally go in and use like an ultrasound and use some type of telemetry to be able to see where this is impacting the nerve. And they'll basically have an injection ready, and they'll help guide the needle to the exact spot where you're feeling pain or exactly where the nerve is being impacted. And they'll use a medication of some kind. It could be a cortisone shot, it could be a steroid, whatever the doctor feels is going to be the best thing to help you with, where they get that pain relieving medication right there at the cause of your problem. And a lot of people find that that can have long-term benefits when nothing else is working. Now, it's important that we kind of mention that, because again, if you can't function in your everyday life and you're having a lot of issues, here's a really, really good, effective, minimally invasive option, because this is something they can do in 20 minutes and you're out. You're not staying anywhere in a hospital. They're going in, they're going out, and hopefully within about a week, you're going to start to feel a significant difference. Sometimes these injections can be done in multiple phases, where they might do it every other week or every week over a 3 to 4 week period. But again, that's going to be something that you talk specifically to your doctor about. Now, something that's a reoccurring injury, this is where it starts to get kind of more fun, or it starts to get a little bit different. One of the reasons why it gets a little bit different or more fun is that, say you don't have one of these chronic injuries where, everyone has a little bit of slippage normally in the disc, but when they did everything, it's not impacting any type of major issues here. When we look at your core, it's not the best. It's a little weak. Your alignment's off. And we're noticing that you just have a lot of tension in that area. Now, the fun thing about this is we can kind of break you down and really try to build you up to get a really positive result here. The reason why we say this is that we look at it and we say, okay, so the first thing we're going to look at is your overall strength and ability to control your core. So we'll do some simple exercises just to gauge how much control you have over the muscles in that area. Now, often people will find that they'll go to do, maybe they'll isolate a glute, or they'll try to isolate just kind of like the movement of the pelvis itself. And they find that those areas cannot function on their own. They find that, when I try to isolate the glute on my right side and pick my leg up, it won't budge. It is not moving whatsoever. Or they go, when I try to isolate just my pelvis and do something like a pelvic tilt, that movement is very jittery and it's not smooth. And we get really excited when we see this because we automatically see a huge red flag, which normally the doctor would have seen also as well. And we say, oh, so you have a reoccurring problem here because something within your chain in your core is completely dysfunctional, meaning that your glute is either not activating or overactivating for certain reasons because you're trying to protect yourself and it needs re-education. Or as these muscles work together to do movements that are essential to stability, they don't have the ability to work together smoothly to allow for the stability that you need. Again, we're looking at muscular re-education there. Now, when I say muscular re-education, we're teaching the body how it should operate or function optimally. Now, in these situations, we're not correcting the type of movement you're doing. We're either getting back a movement you lost or coming back from a deficiency in a sense. So you're doing something so incredibly incorrectly that once we start to gain back that motion that's gone, you're going to start to feel a significant difference in your back. Now, the fun part about this is that because the back is such a complicated area, this deficiencies can come from a number of areas. We've talked about obviously coming directly from the spine, where we've worked on possibly a nerve or a degeneration in a disc. Then we talked about a dysfunction within the muscles. Obviously, you could have an actual bone injury to where you've done one of the spondies where you've fractured or done something of a damaging nature to the bones that's then coming and pinching out on the nerve. Again, this is one that we see in an older population where they tend, or really an older population or very, very flexible populations, where they tend to have a back pain, they don't realize what's wrong, and they've actually fractured part of the spine, and they've just been dealing with this pain for so long they had no idea. Not as common, but it is amazing when you get to see those, because that is truly a shocker when someone walks in and they literally have a broken back that they're walking around on. The last area is just soft tissue in general. So we possibly have a tear to a muscle, or we have something called a myofascial tissue that sits on top of the muscle. And this fascial tissue over the years has bound down so much that it's not allowing for things to articulate the way that we like. Since it can fall into all those categories, that's the reason why we bring this up, is that this is not that easy to find in a 1 week, 2 week, or 3 week period, especially if you're a younger individual and nothing's coming up very obviously when they do all their diagnostic testing. When we find all these problems and there's nothing significantly wrong on the diagnostic testing, we have to start kind of thinking outside the box and saying, okay, maybe, just maybe, we always talk about how amazing the body is at adapting. Maybe you have adapted to the point of you keep finding a way to do it to the point to where now you're completely dysfunctional, where you did something, your body compensated for it. You did another thing, your body compensated for it. And you kept doing this back and forth until everything is absolutely dysfunctional. And now you have to go back and kind of figure out, where did this start, you know? And when you do this, you're going to find a number of different things. And this is, I always tend to be longer rehabs. And when I kind of give people ideas of time, of what kind of time you should be thinking about, if you've been living in pain for 4 months, 5 months, 6 months, it's unrealistic to think anyone can fix this in 2 weeks. If you're going to live in pain for 6 months, that's 6 months you could have been continually doing damage and making something worse and worse and worse. I've always felt that you have to give the person who's working with you at least the equal amount of time to try to fix you, especially if this is something where you're saying, hey, I've been in pain for the last 5 years. Well, I think it's only fair to say they might have significant progress in 2 to 3 months, but you need to be committed to a long-term treatment here, because they're not going to fix 5 years of dysfunction in 3 months. You're going to have to give them 4, 5, 6 months, all the way out to saying, hey, this might be a year or 2 year long recovery process where you might not be completely with them the whole time. They might give you everything that you need and say, hey, now in your everyday life, you need to start having a more active lifestyle, take on the treatments that I've showed you, take on the exercises that I've showed you, and continue to get stronger after this 4, 5, 6 month period, and continue to work through this. And you might need to continue to work through this for another year, maybe even 2 years, before you can really feel like, man, I feel better than I have in years but I just went through 5 years of pain, 6 years of pain, 7 years of issues. I think it's important that we talk about that because too often do people live in 2 to 3 years of pain, and then they expect for a quick result of why someone can't fix this in 4 weeks, why someone can't fix this in 6 weeks. And also when they talk about that time frame, they say to themselves, hey, like I've come here for 6 weeks. I don't know why I'm not feeling better. Well, here's the real question that I always want to emphasize here. When you came in for 6 weeks, did you come in one time a week? Did you come in for 1 hour, one time a week? And now you've put in 6 total hours in 6 weeks to resolve something that you've put in how many hours of dysfunction? You spend 40 hours a week working on your body, doing more damage, adding to the dysfunction, and you're going to give someone 3 hours, maybe a week to try to fix this. It's important that we're very realistic about our expectations when we talk about this, because overall, it's your general health that we're talking about. So I think that's something that we always need to keep in mind when it comes to how you're going to fix problems, is that too often do people do just enough until they feel better, and then they say, oh, okay, I'm fine now. And then the process kind of starts all over again. You need to be able to say, hey, like I'm feeling better, but I want to maintain this function, this new level that I've now accomplished, where I'm no longer in pain, I'm no longer having issues, and I want to maintain it and get even better. In order to maintain that, we're going to have to continue to do some type of rehabilitative process. That kind of sums up everything that we talk about when we talk about chronic injuries or continually kind of like injured different parts of the body. Obviously, there's a million more different injuries in the body that we can talk about, but we're just trying to talk about 2 very regularly re-injured areas and what this may mean, and kind of break down how this works, how you go about fixing it, and what you kind of need to think about when you're going through the rehabilitative process. If you have questions about any specific things that we've already mentioned, whether it's how we would work on myofascial tissue or strengthening programs or things like that, again, like we always say, leave it in the comments. Obviously, anything that gets to a specific medical nature, we're always going to tell you to go see a doctor. There's a bunch of amazing doctors in the area. I mean, I'm talking from the New York tri-state area here. Best part about living in it is you have some of the best doctors in the world. I mean, you have, the Yankees, the Mets, the Jets, the Giants, the Islanders, the Rangers, you name it, the Nets, the Knicks. And every one of these teams has an amazing world-class doctor that works with them, if not multiple world-class doctors that work with them. And every single one of those doctors are available to you right here in the tri-state area. So you're able to see any single one of them. Even when we get into boxers and figure skating and gymnastics and all these other things that because of where we are, there's such a concentration that a lot of the best doctors in the world tend to be kind of in these city areas, So it's really important that you kind of say, hey, if you have an injury, utilize the fact that you're in such a great area, and try to figure out what's going on with that. Next week, we're going to be going into getting back into exercise. That's going to be talking about specifically after having a long break, how do I start exercise correctly? How do I keep my motivation? And how do I avoid kind of getting injured throughout the process? That's going to be a great topic. Join us next week, Friday at 6. Again, have a good one, guys.